I think, yeah, we were talking about concierge care, right? So I think
Well,
that's
part
getting
of it
up now with
is people don't. I was talking to this. Well, you and I've been talking to that second opinion medical practice. I mean, think about why they exist is patients don't patients don't feel like they have any control. They actually don't feel like they're the customer in almost any way, shape, or form in healthcare. They feel like
yeah,
they're just some sort of cog. They're in some sort of big machine and they don't get to decide when it happens, how almost anything happens. And
yeah,
now they look at some new report that shows that now their data is being de-identified and sold off to AI companies and med device companies. And like, hang on a second. I've said this in previous conversations, like, okay, you want to use my data to give me free premiums or something. Give me discounted care. Like
or
if
pay
you're
me.
now making money off my data,
Yeah. Well,
like,
that's when an idea around the whole when Apple started capturing all my data on the phone, right? Like, it's sort of like, remember back in the, I'm going to date myself now, but remember like free internet services like Net Zero, right?
yeah.
Like where it had the little advertisement at the bottom and you could cruise the internet for free through your telephone and just have to look at these advertisements, right? And it's sort of like
Yep.
you get basically paid for consuming. And so
Well, how about
why
I don't
not
mean to
pay
get
us?
off
Why
on
not
that.
pay us for our data? Like,
Yeah.
give me the money, right? And
Well, what's
wherever it's
happening now?
used,
Like I'm watching Netflix and I'm watching Amazon Prime Video, and all of a sudden there's ads coming up. I'm like, hang on a second.
yeah. Didn't I pay
I'm
you?
paying for I'm paying for Prime, and now I gotta pay for all these ads that are popping up. Like, what the
Yeah.
heck is happening here,
I'm
man?
paying
And so
for
you're
my
a patient.
internet,
You're like, hang on a second. My premiums are expensive. My copay is deductibles enormous, and now you're taking all my data, and now you're making other money. You're like, what am I? Just that's what I was joking before. Like, see you walking in, like it's a walking ATM machine, or I guess now it's walking Bitcoin or crypto or something.
right? But yeah, I don't support, this the sale of data. I mean, I see it as like it's my data, and if I want to sell it, great, right? I should be able to at least get a cut of it and opt in or something, right? I mean, in the movies and stuff, like, the writers are writing the scripts, right? And they are getting residuals over the years and stuff. Um, why
Yep.
shouldn't I get residuals on my healthcare data? You know what I mean? I'd be happy to sell it if you want it. But to not have the option just because it's de-identified doesn't mean I didn't generate that content, right? Like that content still has my signature on it
Yeah,
from,
I had to do. I went through a lot of pain to get you that data.
yeah, right?
A lot of pain and
I literally
suffering.
had to be born and grow this whatever's wrong with me for you to learn something from me, right? Uh,
Exactly. At
you know,
least the hackers, the guys that hack and steal your data, at least they're upfront about it.
right?
Not. But it feels like now you got like some guy, some chief data officer at some health systems backed up at the loading bay at the back of the hospital. And it's like, hey, yeah, this bunch of patient data just fell. Where'd you get it? Google's like, hey, so where'd you get the data from? Well, it fell off the back of this truck.
Right. It's like in Goodfellas with the cigarette truck, like when they
Yes,
when
exactly.
they rob the person.
We should do it. We should do a meme with that, right? With patient data.
Yes,
You know,
yes, that would be hilarious.